Okay. Welcome to our webinar today on the COVID-19 pandemic. We are really excited to be able to share with you some great information on the impact of the pandemic on our ABE students, our programs, and how we might think about adult education going forward. So glad to have so many of you joining us today and many returning webinar participants and past folks who have been involved with MK for a long time. We did some webinars back in the spring, so glad to have you all back for some continued conversation. Oops. Just a couple of housekeeping notes for you. The webinar is being recorded and we will have it linked on the MK website for you to view later. We'll also share with you a link to the recording, a link to all of the slides, and all of the reports that we're going to be discussing today. Everything will be emailed to you after the webinar, so don't worry, you'll have all the resources that you need to dig into this information after our conversation together. We ask that you just stay on mute so that we can make sure our presenters can be heard. If you have any questions as we're going, please just submit those in the chat box and we will have some time for Q&A throughout the discussion and at the end of the webinar. So like I said, today we're going to be talking about some new reports on the COVID-19 pandemic and start to dig into a little bit the impact on our ABE community. This is the first part of a two-part webinar series. We're going to have a second webinar next week on where we dig deeper into sort of the health education and health literacy skills that we might be able to help our adult education students develop in our programs. So if you're interested in that conversation, you'll see the link to register at the end of this webinar, and we can share that with you as well with the recordings. So today we're going to focus on the findings of two recent reports that look at how COVID-19 has impacted adult basic ed from a couple different perspectives. The report from MK looks at the program level impact, and the report from our partners at English for New Bostonians that focuses on the student level impact. So we're really excited to have this conversation about the two different perspectives. We're also going to talk a little bit about generally how the pandemic is affecting vulnerable populations, and this will start to set up our conversation for next week when we dig more into health literacy and how that can be incorporated into adult ed. So our speakers today, you see here, those of you who don't know me, I'm Rachel Gwaltney. I'm the director of MK. Many of you are probably familiar with MK in our work. We are the voice of adult education here in Massachusetts. We champion the right of all adults to acquire 21st century English literacy skills, English language, and numeracy skills with a focus on leading to economic prosperity, strong families, and vibrant communities. And Lee, do you want to introduce yourself?
Yes, thank you. Hi, I'm Lee Haller from English for New Bostonians. Thank you, Rachel, for inviting me to be a co-presenter today. English for New Bostonians, for any of you who aren't familiar with us, we create opportunities for immigrants to learn English and pursue their educational, economic, and civic aspirations. As the program manager, I work with the 18 adult ESOL programs we support with grant funding in the city of Boston, and I oversee the grant making, training, and evaluation work that we do. So Sherry, over to you. Sherry, you may be frozen. Do you want to introduce Sherry, Rachel, maybe? Or they, oh, great.
Welcome, everybody. Thank you, Rachel, for inviting me here today. I'm Sherry Ruff, and I work in public health as a health, language, and learning consultant, and it's great to be here today.
Great. So as you can see, we have a really great, robust community and discussion group here with us today, so I hope we'll have lots of good information to share with you. So I'm going to start by telling you a little bit about MKs Report and the learning that we did over the summer. What we did was survey our ABE program community back in the summertime, and we focused on looking at the program level impact. So we had responses from program directors that represented school-based programs, community-based organizations, community college programs, and correctional facilities programs. And as you know, the ABE landscape in Massachusetts is very broad and includes a lot of different perspectives. So it was really interesting and important, I think, for us to make sure that all of these different types of programs were represented. It really gave us a robust idea of who was being impacted by these programs and what some of the differences might be between different types of programs. So we asked in our survey questions about how programs, staff, teachers, and students were adapting to remote instruction. We asked a little bit about how they were being impacted by COVID generally. And we also asked about the challenges and also the opportunities that are being developed through in-person, hybrid, remote learning, the mix of different learning types, and how programs were making adaptations and getting ready to teach in the fall. So again, we really focused at the program level, and the respondents to our survey were mostly program directors. So I'm going to have Lee talk a little bit about English for New Bostonians and the report that they recently did.
Sure, thank you. So our report, which we put out in October, is titled Immigrants Unmute, Voices from Boston's Adult ESOL Pandemic Response. And it pulled together information we've been gathering all spring and summer from a number of different sources. We used some evaluation tools that we pivoted and just changed a little bit in response to the pandemic, and we also designed some new tools. So virtual site visits were the first thing that provided an early look at instruction across our programs. Me and my colleagues visited programs by Zoom, and we could hear about struggles and successes, directly in those classes and in meetings with teachers. Then we designed a 22-question online student survey, which 316 students across 20 community programs and 4 workplace ESOL classes completed in May. Then 5 focus groups in June, including bilingual groups for lower levels, provided a deeper dive into students' first-person accounts of their experiences. And I would just like to take a moment to thank the ENB grantees that are in this webinar now for your work. Well, one person here, Susan Claw, actually helped us design the survey. And then I saw 3 of you here, Michelle Duval, also from the Gardner Pilot Academy, Susan from the Blackstone, and Victoria from ABCD. We could not have done any of this without you, obviously, but your tremendous effort in getting these surveys out and helping us pull together the students for the focus groups and so on. Anyway, then in June, an all grantee convening provided a chance to share out some of what we'd already learned and to hear from program directors in small groups. Then in July, data and narrative reports from our programs with additional questions this year related to COVID response completed the picture. Back to you, Rachel. Thank you.
So what we're going to do now is walk through a couple of the findings from both reports and talk about what we saw both from the program perspective, from the student perspective, and a little bit about how these things reflect what's happening generally out in the world. So from our perspective, we certainly found in both reports that the impact of the pandemic on ABE students is incredibly significant and goes much farther beyond education. We understand that students are relying on their programs for so much more than just the academics. And of course, you can think about the relationships that we build with students and how they come to rely on you for a lot. So, we see that students have faced just an incredible amount of stress through their roles, particularly those who are essential workers and are spending a lot of time on the front lines. We know that teachers are helping students navigate issues like food insecurity, access to healthcare, unemployment processing, rental assistance, finding childcare, helping students get their own children involved in their online schooling, and family care. And we know that as frontline workers, our students are facing additional stress in terms of exposure to COVID and putting their families at risk. So there's just a lot of stress going on. There's a lot happening with our ABE students, and that's sort of blending, bleeding over into their relationship with our ABE programs. Lee, do you want to say more about what that looked like?
Sure, thank you. So expanding on this, about food insecurity, several of our programs actually became food pantries last spring that are still operating now, and that's just tremendous. So these programs are distributing and or delivering food in this time of unprecedented hunger. The impact on students as workers is huge, as Rachel said. When we surveyed students in May, of those students in the workforce, 41% had lost their job or had their hours reduced. Now that was in May, and many of those people have since found other jobs, but often those new jobs aren't at the same level as their previous jobs. Parents were thrust into managing children's online learning with little or no guidance. And those of you who may be parents of children at home, you're experiencing this yourself. And as you know, that is hugely exacerbated by language and technology barriers, those issues that parents face. And then there's the pandemic itself. Students became sick and program staff became sick. One ENB program had more than 40 students catch COVID last spring and 3 deaths. That was just as of July. And yeah, I'll stop there. Transition to Sherry.
Okay.
Thank you.
I think we may actually have lost Sherry for a minute. I know she was having some connectivity issues. But I just want to emphasize this last point here on the bullet, on the slide, that all of these experiences, challenges that many people are experiencing due to COVID are just exacerbated by low levels of literacy. So when you think about trying to navigate healthcare services, navigate unemployment applications and rental assistance applications, of course, all of those things are challenged by our students' low literacy levels. And so they're relying on their programs to really support that work and give them some support, because we know that ABE programs have this really strong relationship. Oh, here's Sherry's back. Sherry, anything you want to add here about this finding and sort of the national perspective? I think you're muted, Sherry.
The findings in MK's report on the high-risk groups have actually reflected nationally and globally the same findings. And so what we find is that frontline workers generally are at high risk, those working in health, manufacturing, and retail, as well as the elderly and non-native English speakers. Specific ethnic groups and some racial groups are also at high-risk populations. And there's a direct correlation between low health literacy and low socioeconomic status as well. And these findings are found in
I think Sherry might have frozen. So while we try to get Sherry back, I think as we've seen, as Sherry is saying, we know that these challenges are reflective of what low-income populations are experiencing across our state, nationwide. We know that they're being disproportionately impacted by the pandemic. So I want to move on to our second finding. We found that programs, staff, students are really pivoting and adapting to remote and hybrid learning. And again, we did this research over the summer when a lot of things are being figured out. So we saw that in our report that programs were using all kinds of different tech tools and really trying what they could and seeing what worked. So that included everything from Zoom to WhatsApp to Google Classroom, texting, phone calls, mailing materials out to students, whatever it took to connect with students and meet students where they are, especially in terms of the technology. I see Susan's comment in the chat about lack of digital skills, and we will absolutely talk about how programs have been helping students adapt to using these tools, as well as teachers. That was a big finding in our report, was that teachers also needed support with the tech side of remote learning. We also found in our study that programs, some programs really switched in the spring. They had all the resources in place. They were easy. It was easy for them to kind of pivot over to remote learning. Others were using the summer for more of their planning, testing, trying out a few different methods, seeing what was going to work with an eye toward fall implementation and really having a strong program ready to go in the fall. We also saw from the curriculum provider side that a lot of the vendors and providers who work on preparing and distributing curriculum and working with programs on learning tools have really pivoted quickly and adapted quickly to ensuring that their resources are going to work in that remote virtual learning environment. So, you know, if working with your curriculum partners is something that you've been doing, we know that they're anxious to learn from folks about what's working and what's not working. So, you know, we know that everyone's trying to move all of these things together online. Things like testing online have taken a little bit longer to figure out, but we're definitely making a lot of progress. So glad to see that the programs are really starting to figure that out. Lee, do you want to say a little bit about what that looks like from the student perspective?
Sure. So students, the first need was students needed devices and internet, needed to learn how to use those devices, needed to learn how to use the programs and systems that they would need to access their ESL classes remotely. Programs reallocated resources and huge amounts of time toward that need, distributing Chromebooks or tablets or whatnot to students and helping them with their internet. With the help of partners like ENB and Tech Goes Home in the City, the programs that we work with distributed hundreds of devices and internet plans to students last spring over a month or two. And by the end of April, you know, instruction in all of our programs was back up and running again. You know, it looked very different, of course, but you know, these programs had helped students get online. Volunteers have been really essential to this effort. They help troubleshoot student technology issues, and they facilitate small group work in breakout rooms, and those are both huge. Without volunteers, teachers have a hard time moving in and out of multiple breakout rooms effectively. It's very different from you know, moving among small groups in a physical classroom. A class can also get completely derailed by one student's technology problem if there isn't a volunteer there to help. Bilingual volunteers are especially helpful with that. We really, ideally, you want at least one volunteer for the full synchronous time of every class session, plus some people who are able to help outside of class with additional English practice and troubleshooting and so on. Back to you, Rachel, thanks.
Great. So of course, as we've touched on a little bit, there are certainly a lot of challenges in doing this and changing over to remote learning and managing our reduced in-person interactions with students. I'll just say from what we've learned in our report is that there are a lot of variations in program settings, and that has really affected the types of resources and approaches that our different programs are able to take in this environment. So, you know, school districts might have different, you know, they have sort of the K-12 system as part of their network. That was helpful in getting more families online compared to, say, corrections institutions, which have very little to no internet access allowed in the way that they teach. So figuring out how to do in-person learning in a safe way was critical. We certainly heard from programs everything from the tech piece to the need for personal protective equipment to and how those resources were made available really varied across different program settings. One finding was that workplace-based programs had a lot of those resources all ready to go. Those are, workplaces that were able to stay in business and had a lot of frontline workers. Many of them were able to keep doing their in-person learning because they had those resources in place. So we saw a ton of variation in the program settings and the approaches to maneuvering toward some kind of either hybrid or remote learning. And I know that, Lee, there was a lot that you found in some of those challenges.
Yeah, thank you. So in our survey, we wanted to reach not only people who successfully continued in class, but people who did not. And there were a lot of reasons why people might not have continued in the class, as I'll elaborate in a minute. But of the students we surveyed, 78% had pivoted to online instruction and were engaged in a weekly, way with their ESL class. The rest were still engaged with their ESL programs, but couldn't participate in the remote instruction. And primarily that was due to lack of time or technology. So of those who had to pause their learning, at least 1/3, 33% said it was due to lack of a suitable device, reliable internet, or another technology issue. And then another 21% said the online class was not good for them. And that may have also been because of, technology and device issues. Even after enormous effort distributing these devices and helping students with internet, of the students that we surveyed, 37% accessed classes only from their phones all spring. It's incredible to me that they remained engaged with their instruction. If you can imagine, being in a class twice a week only on your phone for the whole spring. Another 30% used a combination of phones and other devices. So this really speaks to the incredible dedication of our students to their learning. With device shortages across the country, that problem unfortunately continues this fall. When we were doing this research, we were thinking that, that it would all look really different this fall, and it unfortunately does not. About preparation time, all of you teachers on this webinar, I just salute you with all with everything I am. Teachers, we've heard, are just spending much more prep time than usual, like double at least, and have really just made a huge effort to to provide high quality ESL instruction online, to learn how to do that and then to do it. And it's just incredible. It's taking a huge amount of prep time. Besides additional time preparing for class, the time that teachers spend helping students with myriad other issues takes a toll. And as this pandemic drags on month after month, teachers and programs are exhausted and stressed and showing enormous dedication and care as you continue to work in these conditions. So thank you. Finally, online teaching is challenging and it requires a whole new skill set for teachers. An overwhelming majority of students in focused groups really appreciated their English classes greatly. And they also said that they really missed physical interaction with their teachers and classmates. They missed the efficiency of in-person practice and asking questions and sharing with teachers and classmates. Online learning can disrupt normal question and answer dynamics. For example, when we ask you to ask your questions in the chat. Students aren't as able or comfortable speaking up sometimes for reasons such as bad audio or inadequate time. Many students also said they wanted more writing and grammar practice, and others said they missed games, pair and small group work, and field trips.
Yeah, and Leah, I can really echo what you're saying, especially about teaching. And, we had a lot of programs report just how difficult it has been to get just the teachers to be able to be comfortable with teaching online, and spending a lot of time with professional development over the summer. We know Sabes offered a lot of wonderful trainings on how to help teachers get ready to teach online. We know there's a lot of questions about the new curriculum tools and resources that are available for online teaching. So we really appreciate and recognize the incredible effort that it's taken for teachers to feel comfortable with that online learning environment. So that's absolutely something that we found as well. And I think I'd also add to what you were saying, that we heard some programs sort of making some choices about who is going to be in person and who is going to be remote based on really their level of need. When in the communities where in-person interaction is still possible, or we know programs were doing some classes outside in the parking lot, or creating those safe spaces with enough physical distancing to make learning or in-person interaction possible, they might be using those for intake or the really high needs pieces of the instruction that needed to be done in person, or were much more effective to be done in person. So absolutely.
Yeah.
So the good news is that we also found some unexpected benefits, and I think we're all starting to see some changes to adult education that are likely to last beyond this pandemic. Lee, do you want to start off and talk about that?
Sure. So a large portion of the students in the focus groups that we convened enjoyed the accessibility of online learning. Teachers said that attendance was higher in some classes because students didn't have to commute, and sometimes the schedule was more compatible. The new skills that students learned are going, as they pivoted to remote instruction, are certainly going to help them with work and further education. They learned to troubleshoot through access challenges, choppy audio, and to communicate solely through technology. And many students reached levels of digital literacy that most had never needed previously or imagined they would need. Their textbooks, online supplement, phone, voice, and video recorders, and platforms such as Google Classroom became central to their continued English learning, and the skills they built will serve them well going forward. Okay, I'm going to skip that part. Teachers, one interesting finding that continues is that teachers can meet more easily, even if they teach at different days and times. Programs reported increased communication and collaboration among teachers, especially among part-time staff and with volunteers. So E&B and other training providers also found workshops to be in high demand and to reach a wider audience than previously.
Yeah, and I'll just add to that, as we said before, curriculum providers are pivoting toward new resources that are going to be available for programs. And so they're also seeing, how do we use curriculum for both synchronous and asynchronous learning, and as Lee said, expand the way that students can access their classes and their lessons through technology, knowing that this is something that we will likely be able to use to reach more students. I think that's absolutely the takeaway from our report as well, is that with online learning, students who were not previously able to participate because of scheduling issues are now able to participate. So if we can get the right tools in their hands and make sure that those resources are available and working for them, that we think ultimately that more students are going to be able to be reached. So we hope that that's a change that will last. Sherry, do you want to say another word here about sort of the health piece of this? I hope we didn't lose Sherry again. I think we may have. Okay. Well, as I said,
I have one other.
Oh yeah, go ahead,
Rachel.
Sure.
One additional thing I forgot to say. A number of students in the focus groups, this was really interesting, said that they are more comfortable practicing English online, if they're speaking in something like a Zoom call, than they are in an in-person class, and it reduced their feelings of fear and intimidation when speaking English. And we loved this finding, that there are students for whom this, even very low-level students for whom this way of teaching, it really works for them. So that was good to know.
That's great. Well, I know we've kind of had some issues with Sherry's connectivity today, but she's going to be talking a lot more about how do we think about health literacy and health education as a piece of the adult basic ed picture. We're going to talk about that next week in the webinar that we do that digs more into the programming piece and what some of those partnerships with healthcare might look like and how we can think about incorporating that health literacy into the work that we do down the road. So we'll save that conversation for next week. So a few additional recommendations from our findings that we wanted to share. One thing, of course, that MK is really focused on is the state investment that's needed to support this remote learning transition. So that includes ensuring that programs have the tech devices that they need, the internet connectivity that they need, making sure that students have hotspots, making sure they have the training in place for teachers to deliver this program with high quality. And we also, want to make sure that programs have the flexibility to accommodate the different variations in their conditions and their setting in a way that will work for them. So that's really what our focus has been on in terms of the advocacy for state investment. We're, as you probably have seen through our MK alerts, we're almost at a final budget number. We're seeing strong support for state investment in ABE, but we need to talk more about what does that investment look like around the tools and resources that support remote learning in particular. In addition to being able to serve more students. I think it's also important that we want to make sure that the highest needs students are addressed and that their needs are taken care of. As we said, there's going to be a population of students that are just going to have a really difficult time with remote learning. And how do we make sure that they're able to be supported and able to continue to be successful in these programs, because we know that they're, they need these programs the most, and we want to make sure we can meet them where they are. And I think, for our community, one thing we've heard quite a bit is how do programs make decisions about quality resources and curriculum? How do they know which tools are going to work? Who's vetting the quality of these products and making sure that we know what's going to work and what has the science behind it to be successful? So the field, we need to figure that out together. I know there are folks on this call who have been thinking a lot about that, so listening in. So, we look forward to continuing that conversation together as a community. Lee, what else are we seeing as recommendations?
Sure. Well, this goes along with more state investment, but increased staffing. Teachers need more time, prep time, and programs need staff to help students with other needs, including time outside of class, to help students with devices and access and other issues they have. More volunteers are also needed to support instruction. In addition, to talk about the economic hit that this pandemic has caused in our students, we need to explore new models for jobs or businesses for students in hard-hit industries. So many of our students are in places like the hospitality industry, where the jobs aren't foreseen to come back for a long time, and they've been out for so long. So looking at other models like entrepreneurship or worker-owned cooperatives. Students also need guidance about labor market changes and skills training options and how they may be able to pivot as workers. About flexibility, that's also a need when scheduling classes. Students have to work around their children's schedules now. Everybody's at home. So, so classes that used to meet in the mornings are often meeting in the afternoons after kids are done with school. And traditionally, that's a terrible time to try and run a class. But that's what we're seeing a lot these days. Students, okay, and then finally, keep developing as a field as teachers. And you are and we are, but students in surveys and focus groups shared their ideas of how teachers and classes could help them even more going forward. Most teachers use a group chat, for example, WhatsApp for class-wide class communication, and if any don't, students highly recommended that as community, keeping everybody on the same page, sending links, etc. To the extent possible, given limitations of Zoom and other platforms, they asked for more help with speaking and listening skills, with asking questions, and with opportunities for more practice. students asked that teachers explore options for improved audio and use breakout rooms more, to provide opportunities for them to exchange information with classmates, for example, about workforce opportunities, and to get individual help. Releasing class materials ahead of time and reviewing more often can help everyone stay on track. And finally, students were overwhelmingly appreciative of their English classes. 89% said they had continued to learn English. 80% said their classes provide them with other information and resources. And 71% said classes had reduced their stress. So thank you.
That's great. You know, I think this wasn't in the report, but I think our this thinking about how do we partner differently with the workforce piece of adult basic ed, I think is absolutely something for us to keep exploring. And we're seeing so many changes in the job market for our students that that workforce partnership, I think, will become just even more important. Sherry, any recommendations you want to make now here about health literacy and health education?
Well, first of all, I think that given the fact that the high-risk group for COVID-19 falls within the low literacy learners, there's a great opportunity right now for the ABE and ESOL programs to really embrace health literacy and make that a part of programs and curriculums. I also see that there's a fantastic opportunity to partner with the healthcare system and also with businesses and local communities on developing and creating opportunities for additional health literacy and healthcare services and resources, and working together with education, adult education programs.
Great, thanks for those thoughts. We have lots of time for Q&A, so please go ahead and put questions in the chat box. I know we had a question here from Susan about independent work and homework. Lee, is that something that you saw at all in your report discussed, how students are feeling about homework at this point, and or independent work, and how that might be different in programming with this remote model?
Yeah, I'd actually like to invite Susan to speak up and make that point,
Sure.
if that's okay.
Sure.
As she mentioned in the chat, it wasn't something that showed up in the survey, and it may be something she's seeing more now. Susan is a consultant with ENB who works with our ESL for Parents programs and also helped develop the survey. Sorry, I muted myself too soon. Susan, are you?
I'm here. I can't. Can you hear me?
Yes.
Okay. It's weird in these webinars because you sort of don't appear even when you're talking.
Absolutely.
Yeah, something that, so typically a lot of the EMB classes anyway meet for say 6 hours a week. I've always taught a twice a week, 3-hour class. Well, you can't do that online. And online learning involves a lot more independent work on the part of the students. And so we meet for an hour and a half, and then in addition to what we might have called homework before, we are trying to give students an hour and a half more of instructional work for them to do to sort of make up somewhat for the class time they're missing. And that has been a struggle to monitor it, if we care to monitor it, to help students figure out, you know, when they come to a class, they set aside the time for the class. It's very hard for so many of the students we work with, particularly because in my cohort, it's all parents. It's so hard for them to find that time. And so, you know, they try to do all their independent work in the half an hour before class starts, just like, you know, pulling the all-nighter to write a paper. And it's been really a struggle. I don't know what's going to happen, whether we shouldn't try to expect they make up, you know, all that extra time. I don't know. We're all struggling with it because, you know, we want them to have as much instruction as possible, but it is really a challenge for them to organize their time, the parents, so that they can get that work done.
For sure. And I can imagine there even being value in having almost like an open study session for students to do their work while they're in part of this group meeting, and just sort of doing their work independently and having the teacher there to ask questions or to chime in and discuss a little bit with students as they do their work together. But that idea of setting time aside to get their work done when they've got so much else going on, I can certainly understand that.
Right.
Great. Thanks for weighing in with that. Question here from David about what cities, towns, and the state are doing to address the digital divide, especially for low-income students and families and people of color. So we know that the state has directed some resources toward, particularly to putting hotspots in families' homes. We know that programs like Comcast Internet Essentials are helping to get students and families connected. I do know that there's been a little bit of a disconnect between different systems who work with different vulnerable populations and in terms of putting tech into families' hands. So we know, for instance, that K-12 student Chromebooks can't be used by anyone else by that student. So if you're an adult student, you can't use your child's Chromebook for your adult basic ed programming unless the towns have worked on that. And I know some towns are working on that. So there's definitely, I would say, not a coordinated effort around that. But I don't know if Lee or Sherry, if you have thoughts about that you want to weigh in on.
Well, there's also a connection between technology and health literacy and health in general. And so this technology issue that you're just talking about for education directly goes hand in hand with the need for people to have technology skills in order to be able to obtain healthcare resources. And we're seeing this in the low literacy populations that are also low in health literacy. And so there's a direct relation. So I see that there's an opportunity within this to partner for technology, and also a great need for students and families as well.
Absolutely.
Yeah, I would just add that the city of Boston was just a huge partner last spring. Their Boston Department of Innovation and Technology got hundreds of tablets with pre-installed internet out to our students, and then turned their internet back on this fall when students still needed it. And Tech Goes Home also they're not statewide. They're in Boston and a few other communities. I agree that a coordinated statewide effort is really needed, and then we're also facing device shortages, especially for the devices on the lower end. They're the ones that we'd be able to scale out to meet the needs of our students. So this has certainly underlined that need, David, and thanks for the question.
Mm-hmm. Great. This is a more specific question, which we may or may not have the answer to, but how are folks working around Chromebooks not being able to use for HiSET testing? I know that early on we had heard from the testing folks about some of these restrictions and difficulties getting testing moved online. There were some regulatory issues around testing, especially for students who are under the age of 18. Lee, has there been any conversation about testing amongst your programs and how they're working with the testing piece online?
Some of our programs do offer HiSET, but we just do ESL, so I'm not part of those conversations.
Yeah, if anyone has an answer to Jennifer's question they want to put in the chat, that would be great. I know we'll have some conversations around that at our network conference, just a little plug for network, which I will be coming back to, but we've been trying to work with the testing providers to help spread some of that conversation. Another question from David about using HiFlex blend flex model planning for ABE programs in Massachusetts. That's not a program I'm familiar with, but Lee or Sherry, is that something you're familiar with?
Me neither. You want to tell us about it, David?
Yeah. David, you want to share anything about that?
Yeah, sure. Hi, everybody. David Rosen here. Many universities and increasingly community colleges are moving to something called either a high flex model, that is flexibility in a hybrid model, or blend flex model. They're basically the same thing. There are some variations. Blend for blended learning flexibility. And the concept is really quite amazing. That is that it doesn't matter whether a student participates in real time from home or in person in the classroom, that can work together. So you, as a teacher, have students sitting in your classroom and students at home, and you have discussion, real live discussions. You also have people in the classroom who may be accessing online resources in the classroom. You have all of this archived, so if somebody can't do a real-time lesson at any time, or at a particular time, let's say, they can access the archive and keep up. So basically, with this kind of model, the idea is to reduce institutional barriers to participation and persistence. And if that in fact will be the case, and we don't know, no research has been done on this as far as I know, but if that were to happen, there is the potential that we could significantly reduce loss of students, dropouts, stopouts, increase retention, persistence, completion, all the things that programs have wanted to do for years and not been able to do.
Great. Yeah, certainly something for us to keep an eye on, I think. I know that, and to your question here about, Lee, about how ACLS is going to support the need for these devices and internet. So we know that they've been allowing some flexibility around how funds can be used for technology. We're hopeful about an increase for ABE funding this year, or at least for level funding. And we know that so far the department's approach really has been flexibility. So offering programs the flexibility to do what they needed to do to get online and to get students online. We haven't really seen yet exactly what that's going to look like, but we know that they are going to have more focus on being able to use funds for devices and tech support for getting students online. So we think things are moving in that direction, but I don't think we have all the answers yet. You see this answer here about high-set testing that from Lori, that their program has been using some laptops that they're loaning out to students who are ready to test. So I think that's certainly one solution. I think we've seen some similar models from some of our other programs. We also know there has been some in-person testing still available, or students coming into centers to do testing, coming into their program to do testing. I think that's one of the sort of in-person interactions that programs sort of reserved as high priority was for testing. So, you know, again, trying to work around it, and that's sort of where we were over the summer. Certainly things have changed just in the time since we've done the research for these reports, and things are changing quickly. And we'll keep taking a look and supporting how our programs are able to move forward. So I'm going to move on and share just a few resources, and Lee and Sherry, if you want to jump in with any additional thoughts here, we'll have a moment for that. But you'll have, when you get the slides from us, you will get the links to both of the reports that we've been discussing today. We, of course, want to make sure that everyone knows about the CDC and WHO resources, which have tons of information about what's going on with the pandemic and how to be safe. As I mentioned, we will have part 2 of this conversation next week, where Sherry will be talking about health literacy and education and how we may think about embedding more health literacy into our ABE programming, and sort of what does it look like for adult education to really be part of this health and disease prevention effort. So we're looking forward to that conversation. Please register for that webinar if you haven't already. And Sherry, anything else you want to say about this conversation?
Yes, first of all, I want to invite all of you to come and participate next week. This is open to both ABE and ESOL programs. And as Rachel mentioned, we're going to be diving more deeply into the whole health literacy issue and how education is key to health literacy, as well as how it's been affected through the pandemic. So I look forward to seeing you all and inviting you all back next week.
After this webinar, you'll get a link to a survey just to let us know how we did today. If you need a certificate that says you participated in this webinar today in order to get professional development credit or time from your program, you'll be able to do that in the survey. So just let us know and we will be able to send you a little certificate for that. As I mentioned earlier, please save the date for our Network 2021 annual conference. We're very sad to have canceled our 2020 conference, but we are excited to be back virtually this coming March to do our conference again. We'll have over 40 workshops. It'll be a lot of the same topics and conversations that you're familiar with, as well as new conversations and topics that are related to this online learning environment. So a lot of these questions that you all raised in the chat that we weren't able to answer yet, I am sure that we will be talking about them at Network. So definitely keep an eye on our website for more information. Right now, the request for proposals for workshops is open. So if you have an idea for a workshop that you'd like to submit for Network, please head over to our website and you can find that RFP and all the information about presenting at Network. You can stay connected to us here at MK. You have my contact information here, as well as our social media. You can sign up for our newsletters and action alerts if you want to stay connected with all of the advocacy work that we're doing, as well as all the updates about Network in particular will come through our newsletter. So definitely make sure you're keeping an eye on those channels for information about what's going on. You can also join MK as an individual member. We had a fun membership drive for Giving Tuesday and would love to have more members join us. So take a look at our website. We launched a new website recently if you haven't taken a look in a while, and we're excited to keep sharing new information. Here is the contact information for Lee and Sherry and all of their links and social media, so you can definitely stay connected with our presenters and the wonderful work happening at across our field through our different programs. So I just want to thank
Rachel, can I just, sorry, can we go back to just to jump in for 1 sec about on our website, you can not only find the full report, of course, but there's also links to volunteer if you know anybody who might be inspired to volunteer now. And also a curriculum resource that I didn't mention, but that we developed over the summer, which teaches, it's very, very practical and hands-on for teachers to teach students the skills that they need to access remote instruction. So how to use a Chromebook and how to use Zoom. And there, and it's 2 versions. One assumes that you can have some in-person time, but the one that's that everybody has been using this fall is we're starting up remotely with people, and how can we teach them to use, you know, to access their classes. So all that and more is on our website, and please do follow us on Twitter and like us on Facebook and all that good stuff. Thank you.
Fantastic. Yeah, so many great resources. So I want to thank you, Lee and Sherry, for helping us present this information today. I think the report is so exciting from all of these different perspectives. It's great to have a good understanding of what's happening in our programs and with our students right now. And we know this information is continuing to evolve as things evolve, but glad to have partners like you and like all of you here on the call today about in this work, and we'll keep doing it together. We'll keep moving forward together. So thank you everyone for joining us today. Stay safe, be well, stay in touch with us, and we look forward to connecting with you all again soon. Thanks very much.
Thank you.